Hey everyone, and welcome back for another deep dive,
Always exciting to jump into a new report and
especially one that impacts all of us. You
yeah,
know,
absolutely.
healthcare costs, right?
Yep.
So today we're looking at this PwC report, medical cost trend, behind the numbers 2025.
A lot of numbers in this one,
There are a lot of numbers,
but
and
some really interesting takeaways.
yeah, and they're predicting a near record high in medical cost trends for 2025.
It's pretty wild when you think about it. We saw that continuous rise in 2022,
Right.
and it looks like that trend is continuing.
So right off the bat, what are some of the things that are kind of fueling this surge?
I mean, one of the biggest things is something that we're all dealing with right now.
Inflation.
Exactly.
Yeah.
It's not just groceries and gas, it's hitting the healthcare providers too.
And I imagine it hits them in a lot of different ways.
Oh, yeah. Everything from operational expenses to staffing costs.
So are they just kind of eating those costs, or are they passing them along?
Well, unfortunately, they're having to recoup those costs somehow, and that usually means through health plan contracts.
So it's like a domino effect.
Exactly. Hospitals especially are seeing significant cost increases, and it ultimately impacts us, the consumers.
It all trickles down.
It does, and one of the things that the report highlights is that hospital wage inflation is actually outpacing general healthcare expenditure inflation.
Oh, wow. So it's not just the cost of goods, it's the cost of labor, too.
Right. It's getting more expensive to attract and retain qualified healthcare professionals,
So that means hospitals have to offer higher wages to stay competitive.
which just adds to those rising costs.
So we're kind of caught in this healthcare cost spiral.
You could say that inflation pushes up provider costs, leads to higher insurance premiums, and we as patients end up paying more.
Okay, so we've got inflation as a major driver, but what else is contributing to these rising costs?
Well, another big factor is innovation in the pharmaceutical industry, particularly in medications for chronic and rare diseases.
And this is where things get really exciting, right? We're seeing these incredible breakthroughs, especially in treatments for neurological conditions.
Exactly. But as amazing as these advancements are, they often come with a hefty price tag.
Yeah, I can imagine developing a new drug is incredibly complex and expensive.
It is. Years of research, clinical trials, regulatory hurdles, it all adds up.
So let's get specific. The report mentions a class of drugs called GLP-1 agonists.
Yeah, these are really interesting.
What are they and why are they making waves in the healthcare cost conversation?
So they were originally designed for diabetes management, but they've shown promise in weight loss too.
Okay, so they're multi-purpose.
Exactly. And that's led to a surge in demand. Now imagine if ongoing research proves them effective for things like Parkinson's, sleep apnea,
Wow.
even addiction.
Oh, wow. The possibilities are pretty mind-blowing.
Right. But it also means potential cost implications.
Basic supply and demand.
Exactly. High demand for a new class of drugs with wide-ranging applications. That's going to drive up costs.
And it's not just GLP-1s, right? The report also talks about other new central nervous system drugs for Alzheimer's, Parkinson's, schizophrenia.
Yep. Those are also going to be major cost drivers in the coming years.
So it seems like we're entering this era where some of the most challenging conditions could become treatable, but that treatment comes at a cost.
It does. And it raises some ethical questions about access and affordability.
For sure. Like, how do we balance the excitement of these groundbreaking advancements with making sure everyone can afford them?
That's the million-dollar question. How do we ensure access to affordable care for everyone in the face of these rising costs?
Yeah, it feels like we're at this crossroads in healthcare where innovation and affordability are constantly at odds.
I think that's a great way to put it. And it's something we're going to continue to unpack as we dig deeper into this report.
It sounds like we've got a lot more to uncover.
So, we've been talking about inflation and the cost of medications,
Right.
but there's another piece of this puzzle that we haven't really touched on yet.
Yeah, I was going to bring that up. The rising demand for mental health services.
Exactly. That's a huge factor.
I mean, it seems like it's been growing for a while.
It has. And the pandemic definitely accelerated that trend.
Yeah, I've been reading a lot about that.
The report actually highlights a pretty significant increase in the need for mental health and substance abuse treatment.
And it doesn't seem like that's going to slow down anytime soon.
Right, which is good in the sense that more people are seeking help and recognizing the importance of mental well-being.
Absolutely.
But it also raises some concerns about whether our healthcare system is equipped to handle this growing demand.
Especially when you consider the cost factor.
Exactly. The demand for mental health services is outpacing the supply of qualified professionals.
And that imbalance is driving up costs.
It is. It's a classic supply and demand issue.
So fewer therapists and counselors means higher fees for their services.
Right. But it's also about reimbursement rates from insurance companies.
Yeah, those can be pretty low for mental health services compared to other medical treatments.
Exactly. Which makes it hard for providers to cover their costs and stay in business.
So we're stuck in this kind of vicious cycle where the demand for mental health care is rising, but the resources and financial incentives aren't keeping up.
It's a complex issue for sure.
Okay, so we've got these challenges, but are there any bright spots? Are there any potential solutions on the horizon?
Well, the report does mention biosimilars as a potential area of hope.
Oh, yeah, we talked about those briefly earlier.
Remember, those are essentially the generic versions of those expensive biologic drugs.
Yeah, like the store brand options, but for cutting-edge medications.
Pretty much. They're highly similar, but typically much more affordable.
Okay, so that could help bring down medication costs, especially for people who rely on those expensive treatments.
Exactly. And the report specifically mentions Humira biosimilars as a success story.
Oh, yeah, I remember reading about that.
They were slow to catch on at first, but they've really gained traction lately.
And I think that's partly because of the introduction of private label options.
Exactly.
A private label biosimilar.
Yeah, so those are biosimilars produced by companies that don't have the original brand name recognition.
So they're like the store brand of a store brand.
Exactly. And because of that, they can offer even lower prices.
That's pretty incredible. So we've got biosimilars as a potential solution for medication costs. But what about the overall picture of healthcare spending? Are there any strategies emerging to address that?
Well, one thing that's happening is that health plans are starting to take a more holistic approach to managing the total cost of care.
Holistic approach. What does that mean?
It's about moving beyond just negotiating lower prices for individual services.
Okay, so it's a bigger picture view.
Exactly. They're looking at the entire healthcare ecosystem and trying to find ways to make it more efficient and effective.
So it's less about treating illnesses and more about preventing them in the first place,
Right. And one way to do that is through value-based care arrangements.
which we talked about earlier.
Right. Remember those reward healthcare providers for delivering high-quality care efficiently and keeping patients healthy.
Yeah, so instead of just getting paid for every test and procedure, they're rewarded for actually keeping their patients well.
Exactly. It's a pretty big shift from the traditional fee-for-service model.
But it seems like it could be a more sustainable and patient-centered approach.
It does. And to support this shift, many health plans are creating these things called affordability command centers.
Affordability command centers. What are those?
Basically, they're teams dedicated to analyzing spending patterns, identifying cost-saving opportunities, and implementing innovative solutions.
It's like a war room for healthcare costs.
Kind of. They're taking this issue very seriously.
Okay, so we've got biosimilars, we've got health plans taking a more comprehensive approach.
Yeah.
Any other positive developments to report?
Well, the report also mentions the potential of price transparency initiatives.
Oh, yeah, I've heard about those.
The idea is to make healthcare costs more transparent and understandable for both patients and providers.
So we can actually know what we're paying for.
Exactly. And the hope is that this transparency will empower consumers to make more informed decisions and encourage providers to compete on price and quality.
Makes sense. But I imagine there are challenges with implementing something like that.
Of course. One of the biggest hurdles is just the sheer volume of data involved in healthcare.
Yeah, it's a pretty complex system.
It is. But as technology continues to evolve, we're getting better at harnessing that data and using it to drive insights.
Data analysis, the perennial challenge.
Pretty much. But overall, it seems like there are some positive trends emerging amidst this daunting reality of rising costs.
That's good to hear. So as we look ahead to the future of healthcare, what should we be thinking about?
Well, I think it's important to remember that innovation and affordability don't have to be mutually exclusive.
We can have both.
Exactly. We can embrace these groundbreaking advancements while also striving to make healthcare more accessible and affordable for everyone.
Now, that's a vision I can get behind.
Mm.
But it brings us back to the question of how we actually strike that balance.
Right. And that's what we'll explore in the final part of our deep dive.
Welcome back, everyone. For this last part, I really want to dig into how we can actually make healthcare more affordable and accessible.
Yeah, absolutely.
We've talked about this need for a more holistic approach.
Right.
But what does that actually look like in practice?
So it's about recognizing that healthcare isn't just about treating illnesses.
Right.
It's about promoting wellness and preventing those illnesses from happening in the first place.
Okay, so shifting from a reactive to a more proactive approach.
Exactly.
But how do we actually make that happen? I mean, our system has traditionally been built around treating sick people.
It has. But one way to shift that focus is through value-based care arrangement.
Did touched on that earlier.
Yeah, this model rewards healthcare providers for delivering high-quality care efficiently and for keeping patients healthy.
So it's like incentivizing providers to actually keep people well.
Exactly. And that can potentially lower costs for both patients and insurers.
It's a win-win. But it's a pretty big departure from the traditional fee-for-service model.
It is. It requires a change in how we think about and pay for healthcare.
And that's not easy.
No, but it's gaining traction.
Right.
And it's not just about changing payment models.
Right.
It's also about leveraging technology to improve efficiency, enhance patient engagement, and personalize care.
And speaking of technology, it seems like we're on the verge of a healthcare revolution.
I think so too. Advancements in AI, telemedicine, data analytics, it's all happening so fast.
It really is. The report highlights how these technologies could make healthcare more accessible, affordable, and effective.
Exactly.
Take telehealth, for example.
Yeah, that's a great example. It's exploded in popularity recently.
And it makes sense. You can consult with doctors remotely, often at a lower cost.
And it's particularly helpful for people in rural areas or those with limited access to transportation.
Right.
They can get routine checkups, follow-up appointments, even mental health counseling without having to travel.
And then there's AI,
Oh,
which
yes,
seems to be popping up everywhere in healthcare.
it is. We're using it to analyze medical images, predict patient risks, personalize treatment plans.
It's kind of mind-blowing to think that algorithms can help diagnose diseases and recommend treatments.
I know, right? It's amazing how far we've come.
And while there are definitely ethical considerations with AI,
Of course.
there's no denying its potential to improve efficiency, accuracy, even patient outcomes.
Absolutely. The report specifically mentions generative AI, which can create new content and solutions.
Wow, so it's not just analyzing existing data, it's actually generating new knowledge.
Right. It has the potential to revolutionize the healthcare value chain.
But again, we need to be mindful of the ethical implications.
Absolutely. We need to have those conversations and make sure these advancements benefit everyone.
So it feels like we're at this really critical juncture in healthcare.
I agree.
We've got these rising costs and systemic challenges, but we also have these incredible technological advancements that could transform everything.
It's a time of both challenge and opportunity.
So what's the takeaway for our listeners?
Yeah.
What should they be thinking about as they navigate this complex and ever-changing landscape?
I think the key message is that healthcare is personal and it's evolving rapidly.
So stay informed.
Exactly. Stay informed, ask questions, and be an active participant in shaping the future of healthcare.
Both for yourself and for your community.
Right.
Well said. That's a great note to end on. So thanks everyone for joining us on this deep dive into the world of rising healthcare costs.
It's been a pleasure.